Time now for the exchange. My next guest says calling Mpox solely an African health issue is inappropriate. Jean Kaseya, head of the Africa Centers for Disease and Control and Prevention, joins us now from the Republic of Congo. Jean, welcome to the program. Really alarming trend that we're seeing now and hearing from health officials. They're saying that this new Mpox strain is, quote, changing faster than expected. Explain to us exactly what you're seeing.
Thank you very much for having me, Biana. Let me remind you that in 2022, WHO declared public health emergency of international concern when we had a number of cases in Europe and even in the US. At that moment, if you want to have an idea, in DRC, that is the epicenter of the disease today, we had only 5,000 cases. But currently, we have more than 7,000 cases in DRC. Why we had that? Because in 2022-2023, when we had the public health emergency of international concern, vaccines were made available for European countries, but nothing landed to Africa. This is why you will see that number of cases in Africa was growing because we didn't get support. And this is one of the reasons that is explaining this outbreak that we are facing today.
And this has led to new concern about this new strain known as Clade 1b, and it is described as potentially more lethal. The fatality rate is between 4% and 11% compared to about 1% before. So what more do you need now from the CDC itself and some of the biggest priorities you have in tackling this new strain? Because one infectious disease expert there say that they worry in Africa, quote, we are working blindly.
Let me share with you that we don't have one outbreak. We have many outbreaks in one. When we are talking about Mpox outbreak in Africa today, we are talking at least about 4 outbreaks. The Clade 1A, Clade 1B, Clade 2A, Clade 2B, with so many complexities, with so many changes in terms of epidemiology. And this is what is making us on alert mode. And if you see in the eastern part of DRC, there is this Clade 1B that is also infecting Uganda, Rwanda, Burundi, Kenya. That one is also becoming sexual transmitted Mpox. I think now we are facing what we call the gray zone, because there are so many unknown and we need to conduct so many studies. But what we need currently is to have strong surveillance mechanism to detect all cases. Second, to have the way to test all cases, because currently the testing rate in some countries is 18%. That one is not helping us to confirm cases. And third, we need more vaccine. We need 10 million doses, but currently what we got is only around 1 million that we have as donation from many countries.
What is standing in the way? What is the biggest impediment to getting more vaccines to you right now?
This vaccine is so expensive. And what we need, now that we finalize our continental response plan and we know the needs of each country in Africa, we need our partners to come strongly to sit with us. We need to stop what happened in the past. We need now to talk about solidarity. This action that led for our Western countries, partners, not to provide support to Africa, we need to know that no one is safe. Because today, if we don't support Africa, US and Europe will be infected. Now, let us come together. We are asking our partners to provide sufficient funds for us to procure this vaccine and to make it available for Africans.
Who in the community is most vulnerable specifically to this new strain? Is it women, children, those who are immunocompromised?
You know, the epidemiology of Mpox is so different from country to country, even in the same country, region to another region. You have other countries where it's mostly male and adult. But in DRC and some other countries affected like Rwanda, Burundi, we have mostly young people. Even I saw in one of the health zone in DRC, around 38% of total affected people are children less than 5 years. You can imagine we are putting our future at risk with this outbreak. In addition to the young people, where people with HIV, it means the immunity, low immunity, where people with malnutrition, we have also pregnant women, and we have people living in camps, you know, like IPD, the people who are displaced. I think these are people who are more vulnerable for Mpox.
Right. And when I mentioned women, I should note that it is pregnant women who I know that officials are concerned about as being increasingly vulnerable as well. Listen, time is the essence to get more vaccines, as you said, to Africa as soon as possible. We've seen this happen in the past 2 years ago, and no one wants to replicate that again. And we will obviously continue to be following this very important story. Jean Kaseya, thank you for what you're doing, and thank you so much for joining us.
Thank you so much.